Hi, and welcome to Step Strides. Me, Connor Ratcliffe, and we're back in the garage gym today, looking at some potential loading strategies for our calf, Achilles, plantar fascia. Now today's exercise is going to be a standing, so a weight bearing, bent knee tiptoe raise, and it's a little bit between our videos where we've looked at straight legged tiptoe raises and our seated tiptoe raises. So this weight bearing bent knee variation of a tiptoe raise actually targets soleus a little bit more because we're going into that flex knee position that puts gastrocnemius into a little bit more active insufficiency. So this typically is a little bit more of a challenging exercise, but I think it's perhaps a slightly easier setup, and it just gives us some different options from our seated tiptoe raise version, where we can do a weight bearing variation, or if you wanted to superset back to back straight leg bent knee, again, this is an easier way perhaps to do that. And it just gives us some more options in terms of loading with our patients to work with them for exercises they actually want to do. So it's a nice easy setup for this again, but there are some specific cues, and from experience of doing this, neuromuscularly, people find this a bit more challenging. So there are a few things to look out for. Now this is probably better from the side on view to see. And if we do this bent knee, it's about 45 degrees usually. And I'll always take out balance from this because it just makes it too challenging for people. Now what we want is to just move from foot and ankle. We're going to come up for 1 hold for 2, down for 3 in that typical 1, 2, 3 second tempo. So we're still biasing the eccentric phase, but it shifts the load away from gastrocnemius because we're not in that straight knee position. The flex knee makes it actively insufficient because it crosses the knee joint and soleus doesn't. Come down nice and slowly. So what you might find patients do in terms of that trickier neuromuscular bit is that they can flex knee, but when they come up, they extend at the knee. So actually there's more movement there, and it's not just coming from our foot and ankle, and our tibio-talar or talocrural joint. That's the one we want to move. We don't really want the knee to move out of that fixed flex position. Now this also does put a little bit of demand on quads, so it's just another thing to be aware of, because if your patient's feeling it here and this is the limiting factor, again, it means actually our target structure is probably not getting fatigued enough or not going to failure to reach a therapeutic range. So it's always worthwhile just checking where they're feeling the engagement, and the point at which they get failure of form or fatigue, just check where that is. So if we can do the single limb and obviously double the load, flex knee, up, down, up, down, 1, hold for 2, down eccentric for 3. Now you also need a reasonable range of motion to do this. You'll see I'm in quite a dorsiflex position, foot relative to leg. So it's just another consideration when you're prescribing this exercise. Like our straight legged double limb and single limb tiptoe raises, which are a little bit more biased towards gastrocnemius in terms of our calf muscle complex, with our bent knee version, which biases to soleus, we can still add external load for this. Now for this, I usually do this single limb. Again, watch the video on straight leg tiptoe raises. Similar reason, it's difficult to have balance potentially in your double limb position, and with a flex knee, it's more challenging really. So we'll go through this one in a single limb position to begin with, and then look at a potential version double limb, but it becomes quite compound. You have to use multiple muscle groups and you have to have good range of motion, but it does put you in a really flex knee position So it really does bias the load towards soleus. So the easier version of this, in my opinion, is a very similar setup to our single limb knee bend. So our single limb bent knee tiptoe raise. We're gonna go around this way. A little spin. So in this position, what I'll do is flex the knee, and I'll actually rest my dumbbell on top of my knee, because it just makes the grip and holding position a bit easier. We'll come up for 1, hold for 2, down for a count of 3, in that 1, 2, 3 second tempo, biasing the eccentric phase. Lovely. Now, if we want to do this double limb, like I say, this is a bit of a trickier movement, and this one probably isn't going to be for everyone, but we can get into quite a nice, like, deep squat position, which puts us into knee flexion. And as I say, really makes gastrocnemius actively insufficient. So, typically a slightly wider base for this. Come down, rest those on the knees, into that deep squat position, and then up. Oh, and if we have a look up from the side, you'll see what I mean about flex knee. And again, we need to keep the knee in that fixed flexion. We don't want to end up with lots of knee extension. This becomes a different exercise. But in that position, got me out of breath again, but heavy weights again. What that means is you actually do need some isometric engagement. So there is some quad recruitment, there's glute recruitment, and it is a bit more of a challenging position. So pick your patience for these. Should have used lightweight for this, shouldn't I? Here you go. But that's today's exercise. So these are some bent knee tiptoe raise variations, looking at single limb, double limb, and then with, without weight.